Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine put together by us here at the Virginia Institute for Public Policy so that you can go into all the conversations you're inevitably going to have during the week with good background and information that will help you make the case for good conservative principles. Shane Chalke is on with us, our first guest this week. He is an actuary, and he has done some amazing work digging into the statistics and the mathematics behind COVID-19. And Shane, welcome to the program. How are you doing today?
I'm doing pretty good given everything that's going on, absolutely.
We thank goodness we are in a place that we are. Hopefully we can stay in that place as time goes on. Now, first and foremost, let's get a little background on your career. And for those who don't get into all of the different careers, what exactly does it mean to be an actuary?
Well, an actuary is a type of mathematician that specializes in mortality and financial calculations. So I did most of my career as an actuary, but interestingly, I retired about 15 years ago to become a full-time musician.
Well, probably, sleep better at night. No, but I'm sure.
Or don't sleep at night at all, either way.
It's true. But, and generally, your profession before the musician was, used by lots of insurance companies and things like that to calculate risk and things of that nature.
That's right. So I founded 3 different companies, the first of which built mathematical modeling software and sold that to insurance companies, banks, and finance companies. And I continued as an actuary through 2 more companies, all centered around mathematical modeling and the insurance industry. Yes.
And certainly your halls of academia, you've been a lecturer at George Mason as well as Cornell University, Shane. So what made you want to delve into the statistical numbers that we're getting fed? I'm bothered by some things I'm going to hold on to until we've talked a little bit about what you've seen in the numbers you've been able to chomp on regarding the mortality rates involved in COVID-19 and the modeling. I want to get your opinion later about the modeling that continually seems to be coming up with different numbers than actually come about.
Sure. So early on, I would say early on in March, I was curious about what was likely to happen because I had a number of friends and acquaintances that were, very frightened about this. Mm-hmm. So I was watching the reporting every day in the news like everyone else. So we have this many cases, that many cases, and I wanted to understand what the nature of this function was, how fast it was increasing. So I started to build a model around the daily case reports. And what I noticed quite early on is that even back as far as about March 15th or so, that it was already slowing down. Now, I'm saying slowing down in mathematical terms. There's nothing you could see in the newspaper headlines that would lead you to believe that, because all the newspaper headlines report is the cumulative case count, which mm-hmm. is in many ways kind of a ridiculous number to report. It's almost like reporting how many people have ever had the flu. Well, I can tell you right now it's more than the number of people that are in humanity. It's not that useful of a number, but that's mm-hmm. what the press reports. Mm-hmm. But looking at the subtle inflection of that growth, I could tell it was already slowing down. And so I fit a mathematical model to the case count, and it turned out to be quite accurate from day to day. And I started just sending it out to a few friends saying, look, don't worry about this. You know, the things you're reading in the newspaper about 30 or 40 million cases and 2 to 5 million deaths, it just doesn't look like it's going in that direction. It looks like more like something in the a magnitude less, maybe 1 million cases, something like that. And go ahead.
No, in perspective, I mean, that's versus how many people, are you talking globally or just in the United States?
Just in the United States. I've never modeled anything outside the U.S. I was mostly concerned with what might happen in the United States.
But that's still versus hundreds, I think 340 million people?
That's right. We're about 335 million. Yeah. And yes, so it turned out that this is much, much smaller than was anticipated 6 weeks ago. And the modeling that I did early on already started to show that.
What was it that drove the modeling? Was it the nature of the places that had broken out, Wuhan province, China, northern Italy, places where the healthcare system was far more easily overwhelmed than in the United States?
No, not at all. In fact, there's two general approaches to modeling this thing. There are epidemiological models, which look at numerous demographic and health factors, look at transmission rates, look at mobility rates, many, many assumptions trying to understand what will happen in the disease progression. I took a different approach, which was purely mathematical. I made no assumptions whatsoever about disease transmission. I only looked at the case count every day and fit a model, a nonlinear model to that time series data. That's all I did. And almost as if, it didn't make a difference to me. It didn't make a difference to the mathematics, whether I was modeling COVID or,
any other
population of
coronavirus
fish in a pond or the number of dandelions in a field. It's all, the math is the same. I'm just looking at the progression of a growth rate and trying to understand the subtleties of that curve and projecting the subtleties of that curve over time. And it actually worked very well.
Is it unfair to try to bring human behavior into an equation? Certainly, it's as somebody who struggled with algebra in high school, I don't want to start dealing in X's and Y's. But many people have said, well, it's because of human behavior. We have to have a really wide range because we don't know if this community social distance is better than that community. I was asked about California versus New York. I said, when was the last time you saw a full subway train in California, outside of perhaps San Francisco? But even then, it's not to the regularity New York it has packed full subway cars like no place else but Tokyo. And those sorts of factors, the human behavior factors, are they hard to do as somebody who's done it as a career to figure in human behavior as a mathematical thing?
It is. Those models are quite legitimate and enormously useful, but you'll find that the models that make these different kinds of behavioral assumptions are more useful after we've had previous experience.
Oh, okay.
Right now, we have a new thing, and we didn't even know at the beginning what the gestation period is, what the length of the disease is, what the transmission rates were. So you end up making assumptions for dozens of variables, and the variability of the results of the models is just too vast. It's not that useful. So I took the different approach of just looking at it almost like a black box. If someone tells me, here's a progression of cases, here's the number of days, what does that look like? What does that look like from a calculus perspective? And from that, I could see the subtle slowdown from the exponential.
We're visiting with Shane Chalke, who's a retired actuary, lecturer, taught at George Mason University, lecturer at Cornell University, and from what I'm told, an accomplished jazz musician. And we might need to have you recut our show theme music, Shane. I appreciate your visit.
Certainly.
One of the things that's bothered me about the reporting of, and I've tried desperately to find these numbers, and it's my own fault for not and I'm trying to now keep each daily report from the Virginia Department of Health because one of the numbers that I find notable from its absence in any reporting is the increase in the number of tests. So if they say there's been a 15% increase in the number of COVID-positive Virginians, but they don't report what percentage of more tests were given. So is it out of 8% more tests, we got 15% more Virginia positives, or is it out of 35% more tests, we got 15% Virginia positives? Do you understand? And I just feel
that's
we're
exactly
missing.
Right. So what's happening is testing has increased faster than the disease has increased.
Okay.
So we look back in mid-March, and the U.S. was testing hundreds a day, and now we're testing anywhere from low 200,000s to over 300,000 a day. I shouldn't say testing a day, but reporting that number of tests per day.
Getting the results.
The results. So what's happened over time is we've cast a wider net, and as you cast a wider net, you find more of the disease. This is a big problem for modelers like me. From a pure modeling perspective, I wish that the protocol of who got tested never changed. But of course, that's not good for society, and it's not going to happen. But as they widen the net, they discover more of the disease from people that are, let's say, asymptomatic or wouldn't normally go and get a test.
Right.
And some of the growth that you see in some of the states is as a result of that expansion of the net. Probably a bigger factor is that over time, the states and the CDC have redefined what COVID is. So we see this in almost every epidemic, that you start out with a strict definition. Okay, someone who's tested positive for COVID, has COVID, we report it as COVID. And then we've had several relaxations of that. We went first from verified cases by the CDC to then adding presumed cases, which were cases that were in the testing phase but unverified. And then April 17th, we made the biggest change to add folks to the roster that were never tested, just were symptomatic and perhaps have COVID. And some states are even expanding that further by going back in time and looking at death records and so forth, and
medical records from the decedent.
Yeah, and adding cases that are historical and then punching them into the numbers on a daily basis as if they're new. So that just distorts all the data, and it made some states look like they were growing when in fact they were in decline.
Well, Shane, I've had whistleblowers whisper to me that hospitals get a reasonable amount of money for each COVID fatality. I don't know how that works, and it seems somewhat ghoulish, but I also have been around government programs long enough to know that that's perhaps not surprising. So is there a financial motivation for a hospital to over-report COVID fatalities, especially, or even just COVID cases to increase funding? We watch our hospitals struggle. I'm not coveting the hospitals struggling. I find it bizarre that we're in a health crisis and Inova and UVA health systems are laying off employees, but it seems to be where we are. What about the putting a finger on the scale as an actuary? Does that bother you that there might be other motivations than just pure mathematics?
Yes, it does, and I think it's a host of factors. It's not purely financial. People who are working in the midst of this disease in the front lines are very committed to making sure that everyone knows just how bad it is. So they're not going to leave anything undiscovered if they can. You do have this race at the moment toward perhaps congressional bailout of the states, and that money is going to be divvied up probably based on COVID impact to the states. So there is a political incentive to, if not exaggerate your claim, at least make sure you're fully out there with everything you can find. And these are things that happen at the margin, usually with every disease.
Well, and certainly, the front line, the doctors and the nurses that are in these facilities that are just being hit with it we read stories were flagged out of Charlottesville where the Dr. Breen took her life after coming back from Manhattan, where she'd been treating COVID patients, and I know the psychological strain on somebody who's gone through years and years of medical training, trying to heal people and feeling like you can't keep up with the tide of people coming in and not surviving even your treatments. So the human factor in this beyond the mathematics is stunning. Shane, what do you think the future is, since an actuary, if I understand it correctly, builds the risk for, let's say, an insurance company so that they know going forward what to expect out of something? What do you think, based on your mathematics, is the expectation over the next month or two in Virginia and perhaps at the United States national level regarding COVID-19?
Sure. So right now we're in the phase, it's very clear we're in the decline phase. And the shape of this disease appears a little bit different than others. The incline, the increase in the propagation, looked pretty typical, but the peak is relatively flat and protracted. So it rises fast. It kind of hangs in there for a while at the peak on almost a plateau, and then it declines very quickly. And different states are in different places on this curve. New York, for example, is well past the peak, and New York is down something like, I want to say, 70% from their peak. And
Wow.
let me just explain when I say peak. That's the number of people that are simultaneously sick.
Mm-hmm.
This is not something that the news cares about, but it's a very important way of looking at it.
Yeah,
the number
I
of
would think.
people who have ever had it is not as relevant as the number of people who have it right now.
Mm-hmm. Yeah, well, that's the strain on the system that you're talking
That's
about.
the strain on the system. So that's what I track on a daily basis is I model what I estimate to be the active cases every day, the people who have reported to have had it and still are ill with the disease. So, for example, in New York, that's down considerably from where it peaked 3 or 4 weeks ago.
Mm-hmm.
And so that's good news. I mean, people say, New York hit the hardest, and yes, they did. But we're also in a situation where they're recovering the fastest and the strongest.
Mm-hmm.
So, for example, I model now that New York has less than 30,000 active cases, and that's down from what I consider to be the peak of about 70,000 in early April.
Wow.
Different states are in different places.
Mm-hmm.
And Virginia is an anomaly. Virginia is still increasing, although over the past few days, we've seen it level off. So I think Virginia is probably near its peak cases right now, and I expect that to decline rather quickly, starting this week, in fact. California hit its peak maybe around the 27th or 28th of April, fairly recent, so they're on the downside. But in general, everything's in decline. And I think that what you'll see is that a month from now, these will be very small numbers in most of the states by the end of May.
Shane, one thing that's troubled me over the last week is I've been hearing from business owners who are struggling to get their employees to come back to work. The employees have watched the news, have read the newspapers, have gone online and seen all of the horror stories that create great click-through numbers for websites and newspapers. And yes, I'm being cynical about it because I know a lot of people in the industry, and that's what motivates them.
Of course.
So these employers are saying they're more concerned with getting their employees to come back than their customers, and that's stunning to me. But I guess I understand it. What would you say to a workforce that is recalcitrant in the idea of I don't want to go back to the restaurant I worked at, or the auto parts store, or the mechanic shop, or those sorts of things, because I feel like that fear becomes a real manifestation of the disease as well.
Yes, I mean, everyone's a victim from the very shallow reporting that we've seen through the news. But here's the reality.
Mm-hmm.
This disease is a disease of elderly people in high-density areas. That's it. And outside of the elderly and high-density areas, this is not a particularly deadly disease. So my mortality calculations, which are preliminary because we don't have a great deal of data to go on yet in terms of how many people in broader society actually have this disease. We know how many people have been tested and have it reported, but many people are asymptomatic. So this is one thing that's unusual about this disease.
Yeah. We
have something like half or more that are asymptomatic.
That's still the most frightening. Right? Yeah, that's the frightening part of it is we've got so many people walking around that can give it to their neighbor, but they don't know they have it.
That's right. So we have a couple of data points that help us with this. Probably the most important is the New York State Department of Health did a random test of 3,000 people that were out shopping. And they found out that 15.9% of them through the antibody tests had already had the disease. of a random testing. Well, it wasn't really quite random, but it was pretty good. They randomly selected people that are out and about, are not your random people. They didn't select anyone over 75 because they couldn't find anyone over 75. But we have some idea from that, at least within a parameter, how many people in New York State have had COVID, and it's quite a lot. So I looked at that and looked at the deaths in New York and matched up the deaths with the date of the random study that they did. And without going through a lot of science, I calculate my estimate of mortality for those under 60. The mortality rate, and this is if you catch the disease, you have something like a 0.09% chance of succumbing to the disease.
Wow.
Very, very low. If you're over 60, it's a dramatic increase. I calculate about 2.5% fatality rate for those that get the disease. Now, I'd like to refine this, and what we need is a little bit more data from that random study, which we don't have. I think elderly people were underrepresented because they're less likely to be out shopping. I think younger people are probably the more adventurous ones, are overrepresented. But my conclusion is that if we were to separate society into two populations, those that are, let's say, under 65 and healthy, and those that are either unhealthy, certain comorbidities or morbidities like diabetes, heart disease, and so forth, and those over 65, you'd find this dramatic difference in mortality to even increase. And so, what I tell my own daughters who are in their late 20s, I say, they worry about going about their life. And I say, you do whatever you're comfortable with. But for you personally, the chance of catching this, one, of course, they're both in North Carolina. North Carolina was not very hard hit by COVID. Your chances of catching it are very low. But if you do catch it, your chances of having a bad result are also extremely low. So you put those two together, and you're probably putting yourself in more danger driving to the grocery store than you are being in the grocery store. And that's given their circumstance. They're healthy and young. Now, a totally opposite conclusion I would have for someone who is, let's say, over 65 with metabolic syndrome. That person may be looking at something like, a 5% chance of succumbing to the disease should they catch it. That's a whole different ballpark. So I think one of the things that we're not doing correctly here as a society is we're locking down society and unlocking it based on geographic area. So we say, okay, South Carolina, we're going to release some restrictions. North Carolina is releasing restrictions this Friday. And New York, too early. We can't release restrictions in New York. So I'm thinking that we're just doing it wrong. Rather than doing it geographically, we should be doing it demographically. I think we have probably very little risk as a society in letting young, healthy people go back to work and back around their business. And but at the same time, we could protect elderly folks by advising them to remain under shelter in place until the disease lessens quite considerably. So you could do that, and I think you could have minimal economic impact, less impact on society. But in general, for young, healthy people, it's very difficult to talk about this because there's always examples of people that are suffering badly.
Yes, I understand.
And I feel for that. But it's hard for a mathematician like me to give people some perspective. But that's what I try to do. I try to give them some perspective about this. The average person would have no idea that 3 million people a year die in the United States. So as a percentage of that 3 million, when this wave of COVID is all said and done, COVID will add maybe 3% to that.
Yeah, it's statistically, but it's still a tragedy for those who lose a loved one in that, and that's where I guess we have to realize that It's still on we the people. If what we do as a society is going to continue to function, we the people need to be responsible to our neighbors and to our loved ones, and whether it be bandanas or face coverings of some kind, that kind of thing, to make sure that we're not spreading it, and then working hard in the medical world to figure out what it is and how you can have something but not know you have it and still give it to other people, because that, to me, seems to be the scientific part of this. The biological, the epidemiologists' world is that I'm not going to be satisfied until somebody tells me that we now have a grasp on what to do about something that you could be spreading but not know you have. Because other than that, I mean, that's the nightmare scenario for everyone. You don't have to be George A. Romero to fear that movie. But Shane, thank you so much.
It's so true. It's it doesn't matter if the odds of getting struck by lightning are low if you're the one that gets struck.
Exactly. Shane Chalke, is there a place online? Because I have a copy of your data and your research. Is there a place online folks can read this?
There is not. I've because unfortunately everything about this disease is so politically charged. I've avoided publishing this. I have my own listserv that I do. It goes out to somewhere between 500 and 1,000 people, many of them influential policymakers and epidemiologists, doctors, and so forth. But I've avoided publishing it generally because I just don't want to spend 11 hours a day defending it against silly comments.
Right, and comments not based on what you wrote, but what they feel like you wrote and what they're interpreting. I get it. Believe me, I live in that world every day, Shane. Well, from your lips to their ears, then, and keep publishing to those people who need to hear it. And thank you for spending some time with us on the air here at Freedom and Prosperity Radio.
Excellent. Thank you so much.
Coming up next, legal affairs editor with Liberty Nation, Scott Cosenza, on the court ruling in Lynchburg regarding gun ranges that had been closed and gun shops in the Commonwealth of Virginia on Freedom and Prosperity Radio next. Prosperity Radio next. Prosperity Radio next. Prosperity Radio.